Hello, good morning. My name is Dr. Ashik Hussain, and I am an assistant professor of anatomy at Rashid Latif Medical College, Lahore, Pakistan. In this video, I'm going to talk about the muscles of the anterior compartment of the forearm, which are total 8 in number. Out of those 8, 4 are superficial muscles, and one is intermediate layer. Some anatomists count it in superficial as well, but some give it a name as intermediate. And the third layer is the deepest of all, which is deep muscle. So superficial muscles are, first of all, this is pronator teres muscle, then flexor carpi radialis, then palmaris longus, and then flexor uh, carpi ulnaris, here this one, and these are the 4 muscles, superficial muscle. Then flexor digitorum superficialis, then we have got flexor digitorum profundus, flexor pollicis longus, and then pronator quadratus. So I would be discussing each muscle one by one. So this is the pronator teres muscle. This muscle is pronator teres. It actually has got 2 heads, superficial head and deep head. Superficial head and deep head. And here is its attachment in the middle of the radius on the lateral side. So actually this muscle, its name is pronator teres, but I call this muscle pronator teres. Why I call this muscle pronator teres? For a very simple reason, because it always reminds me that this muscle has got 2 heads, and between these 2 heads, median nerve passes. So sometimes median nerve get compressed between these 2 heads, superficial and deep head. As a result, pronator syndrome develops. So again, I call this muscle pronator teres, and pronator teres, as the name is, concentrate or focus on the name pronator. It pronates the forearm. So pronator teres, it has got 2 heads, superficial head and deep head, and between those 2 heads there is a passage of median nerve. And then in the middle of the middle third of the radius on its lateral side, in the middle, this muscle has its distal attachment, and its proximal attachment is from the medial epicondyle along with the common flexor tendon. Then its deep head, it arises from the coronoid process of the ulna. So this was the pronator teres. So the second muscle, which is flexor carpi radialis, flexor carpi radialis. Uh, I call this muscle flexor carpi secondalis or thirdalis. Flexor carpi secondalis and thirdalis. Why I am calling this muscle a flexor carpi secondalis and thirdalis? So I would be discussing this this mnemonic with you in a while. So first of all, we will go for its proximal attachment. Here's the proximal attachment along with the other common flexor muscles. It rises from the common flexor tendon, and it's look at its distal attachment. This muscle is distally, it is getting attached onto the second metacarpal base palmar aspect. Second metacarpal base palmar aspect. In this particular software or animation, it is not shown, but this muscle in its distal part divides into 2 slips. One is getting attached onto the base of the second, and the other slip is getting attached onto the base of the third metacarpal. Third metacarpal. So secondalis for the second metacarpal and thirdalis for third metacarpal. So my mnemonics get completed over here. This flexor carpi radialis gets attached to the base of the second and third metacarpal on its palmar aspect. So this was my mnemonic for the flexor carpi radialis. You can this second slip you can see in your Netter's atlas. Then we have got palmaris longus muscle. Palmaris longus. Now this is, look at this muscle. Along with it has got also proximal attachment and distal attachment. Proximal attachment is along with other, superficial muscle. It is getting attached onto the medial condyle of the humerus, and whereas its distal attachment, this is palmar aponeurosis. What is aponeurosis? Aponeurosis is nothing but flat tendon is called aponeurosis. So this is palmar aponeurosis, flattening of a tendon. It is actually, triangular in shape. This is distal base of this triangle, and here comes the apex of triangle. So palmaris longus gets attached onto the apex of a triangle, this triangular palmar aponeurosis. Then we have got another muscle. This is called flexor carpi ulnaris. This flexor carpi ulnaris, it actually gets originated from the you know mm, 2 3 points. Number one is medial epicondyle along with all flexor muscles. Then from the posterior surface of the ulna, and it is also from the upper part of the shaft of the ulna, and inferiorly it is getting attached onto the pisiform bone. This rounded structure is called pisiform bone, and if from pisiform bone, it is further getting attached onto the hook of the hamate and base of the fifth metacarpal. So from pisiform to hamate, this particular ligament is not shown in this animation, but you can see this these two ligaments, pisiohamate and pisiometacarpal ligament in your Netter's atlas diagram. So this is flexor carpi ulnaris on the ulnar side. Now I will remove these muscles one by one so you can have better look deeply. So this is flexor digitorum superficialis. So some of the anatomists, they actually include this muscle into the superficial group, but some anatomists, they give it a intermediate name of the intermediate layer. So this particular muscle, look at its shape. It is sail of the boat. So it is originating from the medial epicondyle. Here you can see from along with other common flexors, and from the coronoid process, second attachment, and third attachment from the anterior oblique line of the radius. Okay. One thing you must understand, in case of forearm, anterior compartment of the forearm muscle, deeper the muscle, deeper would be distal would be its attachment. So in the most superficial layer, which you studied right now or learned right now, you saw that those muscle, all of them either got attached onto the metacarpals or carpals. They didn't go further distal. So this superficialis is bit deeper. So look at its attachment, distal attachment. Each tendon, it would divide into 4 tendons, and each tendon would move towards the specific digit, medial 4 digits, and further it would divide into 2 slips. Look deeply, closely zoom in. This is dividing into 2 slips, and those 2 slips, they get attached one on either side of the middle phalanx. One on either side of the middle phalanx. So distal phalanx, middle phalanx, proximal phalanx. So here you can see this tendon, these 4 tendons, they are getting dividing into 2 further slips, and those 2 slips, they are attaching themselves onto the middle phalanx on either side. So this was flexor digitorum superficialis. Now I would go further. This is, here you can see, this is flexor pollicis longus. So this is the most deep layer of the forearm muscle. So deep, as our rule was, deeper the muscle, more distal it will attach. So this is the deepest layer. Look at this, it is originating from the interosseous membrane. There is interosseous membrane between these two bones here, which is connecting these two bones. And this interosseous membrane, this flexor pollicis longus muscle is originating from that interosseous membrane and from the anterior surface of the radius, and it, as it is the deeper muscle, so it is getting attached onto the distal, phalanx. So now look at this muscle. This is flexor digitorum profundus. The word profundus itself means deep. Uh, when you say someone that you are having profound knowledge of the subject, it means somebody is having deep knowledge of the subject. So when the muscle's name is flexor digitorum profundus, so it is understood that this muscle is the deep, from the deepest layer. So look at this muscle. This muscle is originating from the ulnar side, because it is going toward four digits of the medial side. So it is getting, it is also originating from the interosseous membrane and from the shaft of the ulna. And this muscle, profundus muscle, is dividing into four slips, and these four slips, uh, because it is the deepest layer, so these slips would reach till the distal phalanx. So this tendon, four tendon, would pass through the between the two slips of the superficialis muscle, which we saw in uh, our previous muscle, so to get to attach onto the distal phalanx. So this was profundus. Okay, now one more muscle which is here, it is, this is pronator quadratus. So look at the word pronator and quadratus because it has got four sides, because from the quadratus word came from the quad, and pronator means pronator. So look at the shape of the muscle. This muscle is called pronator quadratus. It is also a deeper muscle. So this muscle is, it is getting attached onto the distal radius and distal ulna. So all the forearm anterior compartment muscles, they are supplied by median nerve except for one and a half muscle. So this is the golden sentence. Try to memorize this sentence as it is. All the muscles of the forearm are supplied by the median nerve except for one and a half muscle, and that those one and a half muscle are flexor carpi ulnaris and medial half of the flexor digitorum profundus. These two muscles are supplied by the ulnar nerve, and rest of the forearm muscles, whether they are superficial, intermediate layer, deep layer, they are all supplied by the median nerve. So I hope you've understood my message, or what I was trying to convey. Thank you very much.